Thanks for joining us for today's program, looking at speech and swallowing in multiple sclerosis. I'm Andrea Salmon, one of the Education Program Coordinators, and today I'm joined by Kate Morris. We start all our programs by acknowledging and paying respect to the traditional custodians, past, present and emerging, on whose lands we meet today. I'm in Victoria, on the lands of the Wurundjeri people of the Kulin Nation. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community as well. It is my pleasure to have Kate Morris with us today. Kate is a speech pathologist in New South Wales. She graduated from the University of Newcastle in 1999 and has had 20 years experience working in a variety of settings throughout New South Wales, public and private hospitals, aged care facilities, community, home, schools. She has a strong background in working with adults with neurological conditions, which gives her a lot of background for today's presentation. Kate currently works at Everyday Independence, where she is working with people with neurological conditions, and she's also the team leader of an interdisciplinary team, including speech pathologists, physiotherapists and occupational therapists. So Kate, it's terrific to have you with us today. I'm just going to click to this slide because we thought we'd start off, before I pass over to Kate and see her slides, we thought we'd ask everybody that's online a couple of questions. So the first one is, do you have any difficulties with your speech and swallowing? No, with your speech, sorry, this one's speech. So the options here are, yes, I have significant issues. Yes, I have a few issues. I'm not sure, because that could be the reason why you've come along today. Or maybe no, you don't have any issues, it's just of interest to you. So it's great to get a sense of who's online today and what you're experiencing in regard to your speech and voice, and then we'll run another poll about swallowing. But voting on that, so for those people who just joined in, we're voting on a poll to give us, the whole group, an idea of who's online today, and I'll close that and I'll share the results. So 10% of people who are currently online are experiencing significant issues. 62%, so by and large, the majority of people are experiencing a few issues. 14% not sure, and 14% no, they're here for interest. And then the second one is, do you have any difficulties with swallowing? So again, voting on this poll, just to, again, set the scene, whether you have significant issues with your swallowing, or just a few issues, you're noticing some changes, maybe every now and again. Again, that area of you're not sure whether it's an issue or a difficulty with your swallowing, and no, perhaps you're just here for information. Maybe you're here for information for a family member, and so you don't actually have problems. So I'll close that off again and share the results. And again, similar, 22% recognising that they have significant issues with their swallowing, and 52% of people online at the moment recognising that they have a few issues, 17% not sure what's going on, and 9% no. So that gives a good idea to Kate and I who's online. So Kate, I'm going to click a button here and make you the presenter. Thanks, Kate.
Thank you very much for having me present today. I was lucky enough to do this last year too, so I was really excited to get asked to come back and speak to you again about speech swallowing and the role of the speech pathologist. So it was great to see that, that some of you are probably aware of speech pathologists and our role, but it'll be really great to share some information again today just about speech and swallowing, and further discuss any questions that you have. So the outline of today, there's a few things to get through. So I'm going to give a little bit of a background about speech pathology and multiple sclerosis. talk around why is speech and voice important, and give you a little bit of background around normal speech and voice production, and then progress into what are some of the speech difficulties and typical speech changes that people may experience with MS. We're also going to talk about why is swallowing important and have a look at some of those typical swallowing changes that you may or may not experience with MS. And also talk about some strategies around both speech and swallowing as well, which will come later in the presentation. But the other thing is talking around when might someone be referred for speech pathology, what's involved in an assessment, and talk a little bit around the interdisciplinary team as well. And we'll have some time for questions at the end, but as we talked about earlier, just keep popping some questions down into the chat and we can hopefully get to them. So speech pathology and MS. So the demyelinating lesions caused by MS may result in spasticity, weakness, slowness, and or the incoordination of the lips, tongue, jaw, soft palate, voice, and diaphragm. So there can be varying degrees of motor, sensory, and cognitive impairments which can affect speech and swallowing. So I think it's important to note that not everybody is the same at all. So we often see different things that are happening with everybody. So I think it's really important just to note that even though you may find that you are getting some difficulties, it's not going to be the same for everybody. So speech and swallowing difficulties, they can have a negative impact on the person's quality of life and independence. And people may find that they don't enjoy activities that they might have enjoyed before, or sometimes they avoid activities. So I think it can have a big impact, and it's really important to recognise that early. So I think as we notice that maybe some people haven't been referred to speech pathology, and even though speech and swallowing difficulties are really common in MS, referral rates do tend to be quite low. But providing therapy for speech, swallowing, and cognitive difficulties may not improve the person to their original condition, but can certainly be helpful in re-establishing functional daily activities and independence as much as possible. So it's really important that we work with our clients and our participants to focus on what's important to them and really help them to get back participating in those activities. So I think there's a few things that I've written down here, but there certainly can be a lot more to this list. But why is speech and having a voice important? So some examples there: being able to read to our children, being able to talk on the phone, that's a really important thing. If you're working, being able to participate in meetings at work and have a say, being able to have a conversation with our friends when we go out with them, being able to express an opinion or feeling, that's really important to us as well, and being able to ask for directions. So if you're at the shops and you need to find something. So all of those things are really important, and it can be quite difficult if you're having trouble with your speech in participating in those things. So what is involved in normal speech and voice production? So it's actually a really integrated process. It involves a lot of these processes to work together to be really smooth and to make sure that all of these things are in conjunction with each other. So one of those things is respiration. So how we control our breathing for speech. How are we able to have good breath control that we can let out air as we're speaking rather than sort of all at the beginning and then fading away. Phonation. So how are we using our vocal cords to produce voice? Do we have a good strong voice? Can we project our volume from one room to the other? Resonance, how we direct our airflow for speech. So that's really important as well. Articulation, how we coordinate our muscles for clear speech. And that is, if somebody's speaking and it's sounding a bit slurred, or if somebody's speaking and it sounds very mumbled. And sometimes it's important to remember too that some of those things can be different at different times of the day. The other thing is prosody, so how natural our speech sounds. Does it sound at just a normal speech rate, or is it quite slow? So all of those processes are really important, and they can all impact on one another. So approximately 40% of people with MS may have speech problems at any time. So this may occur due to lesions or damaged areas in the part of the brain responsible for the muscle control of the lips, tongue, soft palate, vocal cords, and diaphragm. The symptoms and severity, they can depend on the extent and location of the MS lesions. Most usually they're in the brainstem or in the two large lobes, which are the cerebral hemispheres. So speech problems are more prevalent as the disease progresses, and we often see that they're more prevalent in those with mobility issues. Dysarthria is a word that you may have heard before or you may not have heard before, but it is what we use to describe the speech disorder that can occur in MS. So it's caused by a neuromuscular impairment, which results in disturbances in motor control and coordination of the speech mechanism. So we can talk about dysarthria in different terms, which can be spastic, ataxic, or mixed, but it's generally based on what symptoms are present. So some of the problems that we might have with our speech and our voice with dysarthria are slurred speech, imprecise articulation, reduced loudness or difficulties controlling volume, a slower rate of speech, monotone or lack of intonation, which is often what we will call scanning speech, and sometimes disfluency. So some people can present with what sounds a little bit like a stutter. So it is important, as I've said before, people can have one, none, some, or all of these symptoms. But these speech difficulties can often lead to difficulties being understood and difficulties participating in conversations. Another word that we often use as speech pathologists is dysphonia, and that's what we use to describe a difficulty with your voice, and it can often occur alongside dysarthria, and that is because the same muscle structures and neural pathways are used for both speech and voice production. So what we can often hear with dysphonia is a change in voice quality. So somebody may sound quite hoarse or harsh or even breathy, and sometimes they may have difficulties with that airflow. So it might be sounding like a hypernasal sound, which is like if you were pinching your nose and it sounds a little bit like that, or hyponasal, which is where it's quite a congested sound. People with MS may also have cognitive or language difficulties. For example, difficulties finding words, difficulties with memory, concentration, and problem solving. And there's a little bit of mixed I guess, evidence out there around that, but certainly from my experience, I've had, come across that quite a lot. So I'm going to get back to that in a little while, but I'm just going to introduce about swallowing now. And I think having a little think about why is it important is also a good idea as well. So I guess we also could talk about swallowing in terms of mealtime management. So how do we manage our meal times and how do we participate in our meal times? So things that we love to do is being able to have coffee with friends. We're such social people, so we're often catching up with people, and it always seems to revolve around food or drink. And you know, every family celebration or event that you might go to might have food or drink involved as well. So I think really being able to participate in those activities is really important to us. Being able to sit down with your family for a meal at night, and being able to eat and drink the same things as everyone else. I think that's really something that you know, people may find frustrating if they've got to start making some changes to their food. So I'm just going to go through the normal swallowing process, and I guess now's probably a good time, if anyone is eating morning tea while they're listening, have a little think about what you're doing as you're eating, because there are a lot of different processes involved in it, and we're not often aware of it. Some things just happen automatically without conscious thought. So if we think about eating, say, a biscuit or something, food enters the mouth, and it actually can take some effort to get even to this point if you're having difficulties feeding yourself. So food enters the mouth, tongue and teeth grind the food, food mixes with saliva to make a ball, or what we also call a bolus, and the tongue sends it backwards. And at this point, we consciously control this phase. What happens next is the soft palate raises to block off the nasal passages. The tongue pushes the bolus out of the mouth and into the throat. And at this point, it becomes involuntary. The epiglottis and the vocal cords move to close the airway that leads to the lungs. So this stops the food going down the wrong way. And if it does go down the wrong way, that's often when we'll see somebody coughing. Throat muscles squeeze together to push the bolus down further towards the stomach, and that's where we start with the esophagus. The muscles in the esophagus contract and they push food into the stomach. And once the bolus reaches the stomach, it opens to let it in and then closes again to prevent food coming back. And we often will hear about that in the form of reflux. So the same muscles and organs involved in speech are also involved in swallowing. So evidence shows it's pretty similar to the speech. About 30 to 40% of people with MS may experience difficulties with swallowing at some time. And we call this dysphagia. So I know speechies have a lot of these different terms, and it can be a little bit confusing because they all sound a little bit the same. But if you have heard of that word, dysphagia is what we call a swallowing difficulty. So these problems can come and go. They can be mild, they can be severe. Some people may have difficulties swallowing during a relapse, and these may resolve as they recover. Some people might have more difficulties when they're tired, and it might be at night that they notice it. So it can be quite variable. So MS can cause dysphagia if there is damage to any part of the brain that controls swallowing, or damage to the connections between the brain and the spinal cord. So that's the brainstem. The messages in the brainstem control movements of the body. So damage to this area can lead to a combination of symptoms affecting muscles used in swallowing. People who are more physically impaired are more likely to have swallowing difficulties, and that's due to the role that the brainstem plays in mobility and swallowing. Swallowing difficulties are much easier to manage if they're picked up earlier. Often you can still enjoy a normal diet just by using compensatory strategies, or sometimes it might be just making minor modifications to texture or the environment around you as well. That's often a big one. Your needs and difficulties may change over time, so you may need to be reviewed regularly by the speech pathologist. So some of the typical swallowing changes that we might see slow oral preparation. So there might be difficulties chewing food and getting food into that ball that we need for it to get down smoothly. We might feel food sticking in the throat. It might be really hard to initiate that swallow, so you might really need to put some extra effort to get it down. We might see coughing during and after eating and drinking, or choking on certain foods. There also might be difficulties managing saliva, for example, dribbling. And often that is not due to excessive production of saliva. It's really just often due to just reduced oral motor movement. And also that sometimes we're less likely to be swallowing as frequently as maybe we were before when we had full control over that muscle. Dry mouth, sometimes that can be a side effect of medications, but that's a really important one to manage because it can lead to tooth decay, gum disease, and discomfort as well. Reflux is a big one, so food or drink coming back up, and excess saliva or dribbling, which I also mentioned before. These difficulties, if left untreated, they may lead to more serious difficulties, for example, aspiration pneumonia. And what that is basically a chest infection, but it can be if there's saliva, food or fluid that has gone into the lungs and become infected. So people can be very unwell with that. So it's a really important thing to avoid. And also malnutrition, not having a very adequate diet, not eating enough, and dehydration, not drinking enough and becoming dehydrated as well. So some other things to consider, and I did mention a little bit of this before, that there is a lot of fluctuation throughout the day, and there's certain things like stress, fatigue, heat and pain. Certainly from my experience, I see a lot of clients with those particular difficulties around those things. Distracting environments and a lapse in attention, that can also contribute to difficulties. And I think often swallowing difficulties are overlooked until a choking episode occurs. And I probably do often see that with my clients as well, that there might be some minor things that people probably haven't paid too much attention to, but then there might be something significant that does happen. And that's when they do become quite worried and they might see a speech pathologist at that point. Doesn't mean that you're going to continually have those choking episodes. Sometimes it can just be a reason such as a distracting environment or just an exacerbation of symptoms, but it's really important just to make sure we're managing it. Difficulties at mealtimes, they can be often compounded by difficulties feeding self. So some people may have a hand tremor and that might be quite difficult to eat. Some people might get frustrated, I suppose, when they're eating and think, oh, I've had enough, because it's just quite hard work actually feeding yourself. So I think that's a really important thing to see if we can help with that as well. And also some people who experience cognitive changes, they may also have difficulty swallowing, and sometimes that can be due to impaired judgment. So people may be taking bites that are too big, or choosing foods which might be difficult to chew and swallow, or choosing incorrectly on the menu when they're out for dinner or something like that. And sensory difficulties, that can also be a factor as well. So for example, a lack of feeling cold or even pain, that can also interfere with swallowing. So I think we're going to go to another poll now, because I'm just interested to see if I guess how many people have been to a speech pathologist before, or if somebody has a speech pathologist involved.
That's great, Kate. Yes, I'll launch that poll. So that's exactly the question. Have you ever seen a speech pathologist? So again, your options to answer are, yes, I've seen them once, only for an assessment, or yes, I see a speech pathologist occasionally, or maybe you see someone regularly, or maybe your answer is no, I've never seen a speech pathologist. So that would be great to vote on that. And I'd also just say thanks for the people that are popping in their questions. This is going to set us up really well for a good question time towards the end of the presentation. So don't feel that you have to wait till then. Pop your question in any time. So if everyone's voted on that, a couple more people to vote if they can or want to, and I'll close that off. All righty. Okay, I'll close that off and I'll share the results. So 64% have never seen a speech pathologist. Then we've got 14% who have seen a speech pathologist once for an assessment, 7% who see a speech pathologist occasionally, and 14% of people online right at the moment see a speech pathologist regularly. Thanks everyone for sharing in that.
Great, thank you. And that is very interesting, because I think that's quite similar. I know when I did this last time, there was quite a lot of people who had never seen one before. And I think that, like what I said before, I guess sometimes it can be related to, you might have some mild difficulties, but I guess they don't mean all that much until that something significant might happen, and that's often what we would see. But I think it is important to have contact with a speech pathologist, even if it is someone to check in here and there. So when might someone be referred to speech pathology? So I think it's really important to start thinking about seeing a speech pathologist when you notice that speech problems begin interfering with everyday communication. So for example, is the person being asked to repeat words? Is it harder to carry on conversations because your speech is unclear, or is it too quiet? Can the person talk fast enough to keep up with their thoughts? So is it interfering with your everyday communication, and thinking about who you communicate with? Who are the people that you would see regularly? Are there certain situations that communication is really important? So thinking a little bit around that. And also with their swallowing and mealtime management. So when people are observing that, so are you experiencing frequent chest infections, or are you continually losing weight? Are you taking a long time to eat meals? Are you reporting coughing when eating, or are you just noticing that there are some difficulties chewing or trying to control that food? So what is involved in a speech pathology assessment? So it's certainly nothing to be afraid of at all. The speech pathologist will talk to you about your goals. So what's important to you? And that, I think, particularly working in the organisation that I work for, Everyday Independence, that's certainly something that we put people at the centre of all of their decisions. And what is important to you is what we want to work towards. So what's working in your life at the moment and what's not working? What are your strengths and what are the areas of difficulty? What are we able to build on those strengths to really help with those areas of difficulty? And what are the barriers that you have to live an everyday life? So what is actually getting in the way of you living and doing all the things that you enjoy doing? So the assessment process, and it might, I think probably most speech pathologists, even if you come to us saying, oh, I don't have any swallowing difficulties, I've only got speech difficulties, or vice versa. I think, you know, a well-rounded assessment, if you've never seen a speech pathologist before, is really important. And I think that we would look across the spectrum of difficulties. And if you're not having particular difficulties in an area, we would still probably discuss those with you and build your capacity to identify anything that might come up in the future. So in terms of your speech, yeah, we would look at what you're concerned about. Can people understand you? Can they hear you? We would also just do an examination of your oral muscles, and that's nothing to be afraid of as well. It's just us having a look in your mouth, basically. Don't do anything that is uncomfortable or hurts or anything like that. We just look at all those muscles that you would use for speech. So we look at how you're moving your lips, how you're moving your tongue, look at how your soft palate's moving. We would look at your dentition, things like that, all the things that are important to being able to use speech and articulate. But also we look at how you're controlling that movement. So we just get you to do a few different things. So we could look at how fast you could move your muscles, what was the range of movement? Is it a big range of movement? How strong are those muscles, and how are you coordinating them? Because that's really important for speech. We'd also just get you to do a few activities so we could assess your breath support and control and see what your breath support is for speech. We would look at your voice quality, so we would just have a listen to your voice and, you know, is your voice, as I mentioned before, strained or breathy or harsh or anything like that. And we would listen to how clear your speech sounds as well. So I think I've mentioned a few times, like everyone's different, so not everybody would have all of those areas that would be something that would need attention, but it's certainly something that we would look at just to make sure that a good assessment was taking place. And in terms of your swallowing, so usually that's just we would probably come to see you at a time when you were having a meal. So if it was lunchtime or something like that, and we would discuss your concerns again. So what's your current diet? What sorts of foods and drinks are you having? Which things do you like to eat? Which things have you stopped eating because it's difficult? Have you lost weight? Have you had chest infections? So it's a lot of background information gathering. The examination of the oral muscles, very, much the same as what I just said in the last little section, because those muscles are used for articulating and speaking and also for chewing and swallowing. So exactly the same. Observation of a person eating and drinking various foods and drinks. So we may, have a look at how you're going with just a normal meal, but probably ask to have a look at a few different consistencies as well. So if maybe things that are quite different, so maybe some yogurt and some fruit and some sandwiches, some meat, so different consistencies that would give us a good idea of whether there's anything that's a bit of a challenge or not. I wouldn't say super common, but sometimes, speech pathologists might refer you on for further investigation. We have some procedures called a video fluoroscopy, which is also called a modified barium swallow, more so modified barium swallow here in New South Wales. But if they need further information about your swallow, and that's what that is a moving x-ray of the swallowing process, and it allows us to see problems happening inside the body. Often just doing an observation of somebody gives us a lot of information, but very occasionally if we need some more evidence to back up what we're thinking, or there's things that don't quite make sense and we need another piece to the puzzle, that might be when you would be referred on. So what is involved in the management of speech difficulties? So if you're noticing that you have some mild to moderate difficulties with your speech, some of the things that you might try, and once again, it's very individual, but these are some things that could help. The speech pathologist may offer strategies and exercises to assist in strengthening function. There's probably, mixed evidence around doing oral motor exercises. I know when I first did my training, 25 years ago, I suppose, when I started uni, that was a very big thing that people did, continuous oral motor exercises to strengthen function. And it's not necessarily being recommended that it's all that beneficial these days, but sometimes in certain circumstances, people may find some exercises that do help with that. Certainly strategies are a very big thing for the mild and moderate cases. So teaching and demonstrating these strategies to help make speech clearer and more natural. So for example, things like just slowing down your speech rate if you're talking too fast, over articulating. So what that means is really moving your mouth more and really very precise. So I guess kind of like what a newsreader would be like when they're reading the news. Phrasing, so pausing between words so that we're not sort of getting too incoordinated or rushing, and pausing. So teaching and demonstrating strategies or exercises that target loudness and breath control, that's a really important one for some people, and assist you to learn the skill of self-monitoring. So being able to really recognize when you're having difficulties with your speech is so important, because you're the one that you're around yourself every minute of the day, but also I guess engaging your family in that as well, because building the capacity of your family, and the speech pathologist would do that as part of their therapy, to be able to prompt you to use some of these strategies until it becomes second nature. There is some emerging evidence that speech can be improved by a course of Lee Silverman voice treatment, and that's actually quite an intensive voice program that is done with Parkinson's disease. So there is a little bit of emerging evidence coming out now about that. And in some cases, medication or Botox injections have been used to improve voice. And I think also sometimes too, I guess some medications for some things may have that added bonus of helping with speech. So for example, a medication for spasticity or something might have some added improvements to speech, but generally speaking, there isn't like a medication to improve speech alone. So in severe cases, so when a person's unable to communicate functionally or their safety and well-being is affected, the speech pathologist may introduce augmentative forms of communication. So for example, alphabet boards, apps on iPads, or other high-tech devices. It's relatively uncommon, but certainly I think it's important. I would probably start introducing things like that for people before they need it, so just so that they're used to using it, it's working well, and then that way if their speech is getting worse over time, they've already got a system in place that's not so hard to learn, and so on. I also certainly start introducing things like that for people if they're really noticing, say, they might be all right for 3/4 of the day, but as the afternoon comes around, they're really tired, their speech is not great, their thinking's not great. So having some systems set in place for periods of the day is a great idea as well. And I did sort of cover a little bit of this, but speech strategies, I think it's important to remember that it can affect each person differently. But yeah, so then these strategies are just simple ones that I would recommend, but they may or may not be helpful to you. So if you're unsure, please see your speech pathologist. So things like speaking loudly and slowly, minimizing background noise, that's an important one. Sometimes if you're trying to communicate in a really noisy room, it's going to be much harder. So yeah, turning TVs off and shutting doors and things like that, just to make it a little less noisy. Facing your listener so that they can really see your face, see your lips moving, get a lot of that visual information that we get from communication as well. Separating words with little pauses, because sometimes if we're rushing or running our words together, you can't hear where one ends and one starts. So really trying to separate those words is a great strategy. Exaggerating your speech sounds, like I said, that over articulation. Taking a deep breath before you start to speak. So that's something that often does need to be worked on. It's you might take a deep breath, but sometimes people will just let it out very quickly at the beginning of a phrase, and that way the rest of the phrase just dies away because it's very soft. So really trying to practice letting air out slowly as you speak and having more of that control over your breathing. Ask your communication partners to let you know if they're having difficulty understanding you, and work on your self-monitoring, like I mentioned before. Sometimes aids such as voice amplifiers are quite useful, particularly in those noisy environments. There's a lot of great voice amplifiers around these days. But yeah, just having an alphabet board, picture cards, or speech generating devices as a backup to your communication can often be quite helpful as well. And then if you were seeing the speech pathologist in regard to swallowing difficulties, so some people, I guess, do get a bit frightened about this part of it, thinking, oh, they're going to tell me I can't eat this and I can't eat that. And often it's really that we can just give people advice regarding diet textures and diet modifications, but it's also sometimes there don't have to be a huge change to what you're eating. It might be there might be a strategy that we can suggest that might help you to continue to eat safely and eat those foods that you're finding challenging. But yes, often there can be exercises or strategies that are the answer there. Occasionally people may find that they need to avoid certain foods, but yeah, we certainly make, I guess, do the best that we can to keep people eating and drinking the foods that they really enjoy and participate in eating with family and friends and so on, but just by doing it as safely as possible. And monitoring and managing symptoms early may prevent more serious problems, like I mentioned before, such as aspiration, pneumonia, malnutrition, or dehydration. In the later stages, weakness and fatigue, sometimes that can be a real problem, and that leads to inadequate oral intake, and alternative feeding options may need to be considered. Often, probably the step before that is really getting the dietitian involved and making sure that, there's supplements and things like that that could be suggested. And sometimes, yeah, that's a really good in-between step there too. So once again, these are just general strategies, but these are things that I'd probably talk about with my clients. So definitely see your speech pathologist to make sure that they're working for you. But just generally speaking, always sitting upright for meals, preferably at the dining table, feet on the floor, with a nice supported back on your chair. Yeah, often I think if you can eat at the dining table, that's the best because you are really well positioned there. If you need, I'll probably talk about this a little bit later on, but if you need sort of extra supports for your positioning at meal times, definitely that's where we'd work really closely with the physios and the OTs as well, just to make sure that you've got the most supportive positioning for eating. Taking small mouthfuls of the food or drink at a time, chewing really carefully, so really just thinking about that process. Make sure you've cleared your mouth before putting any more food in. So sometimes you might need to just move your tongue around inside your cheek just to get rid of any kind of food that might be sitting in there between mouthfuls. Concentrate, so minimizing distractions while eating. So that's another one where, having a noisy environment can be really distracting, and that can sometimes cause some, lapses in attention, not being able to focus on what you're doing. So I think trying the best that you can to minimize that by turning TVs off, turning the radio off, shutting the windows and the doors so there's not so much noise from outside. And that sort of runs into the next one too, like avoid talking whilst eating. I know that's hard because if you're going out or you've got a big family or something, there's a lot of chatter that happens at meal times. But I think I've got one client actually who has a great strategy of he is eating, but he has the notes app on his phone open next to him. So if someone asks him a question, he just quickly types it into the phone and just shows them the answer. He's very conscious that can be a difficult thing for him, so he needs to focus. So I think that's quite a good one. If you feel yourself getting tired when eating, stop and have a rest. So remember, like, there's a lot of things, there's muscle movement, there's breathing, there's a lot involved in eating. So definitely recognize when you're feeling tired, stop and have a rest. Keep your chin down rather than throwing your head back. Particularly, that's probably relevant a lot when you're drinking. Some people, when they're at the end of the cup, they might throw their head back to get that last little bit out. Just think that when you throw your head back or tilt your head back, it's opening up your airway. So you're actually putting yourself at risk there of it going down the wrong way. So just try and keep your head up. If rather than tilting your head back to get that last little bit of drink, maybe try a straw for that last little bit. That's often a good strategy as well. Thinking about swallowing, so bringing your swallow under voluntary control. So just making sure that you're really attentive when you're eating and drinking and thinking about what's involved there. Eating often, so smaller, more frequent meals may be easier than larger meals, and also remain upright after you've eaten for at least 20 minutes. So really avoid reclining in your chair or going back and having a lay down directly after a meal. That's a really big one as well. Drink lots of fluids during the day and keep hydrated. If you've got muscle weakness, sometimes you might need to place food like a little bit of a different spot in your mouth, maybe towards the back of your mouth. Think about what foods that you are eating or you're ordering, so really choosing them carefully. So consider textures, tastes, temperatures. Avoid foods that might be difficult, so some foods that have hard or tough skins, or those that fall apart in your mouth. Sometimes dry and sticky foods can be a little bit more challenging. Try and really keep an eye on your weight, so don't sacrifice your nutrition. So really be mindful that, yeah, we do work together really closely with dietitians, and I think it's really important that you make sure that you are eating a good diet and you're eating regularly. Take your time and don't rush when you're eating your meal. Try to remain relaxed when eating, because anxiety can often make swallowing worse. Sometimes alternating mouthfuls of food and fluid can help with the sensation of food getting stuck in the throat. And sometimes just doing an extra swallow. So you might eat something, have a swallow, and then have another swallow before putting anything else in your mouth. It's just an extra clearing swallow in case you need it. And if you are needing to clear your throat, or you notice coughing or gurgly voice during meal times when you're talking, you may be at risk of food or drink going down the wrong way. So if that's something that you are noticing is happening quite a lot, it is definitely best just to get checked out. And it might not be a regular thing that you need from the speech pathologist, but I think having a mealtime management plan, which is after we would do an assessment, we would put a lot of these strategies on that plan, and I think that's something that you can always refer to, and your supports and your family and your carers can refer to it when they're coming in to help you as well. And it's something that we can then go back and review. Some people might have it reviewed every 6 months, some might have it reviewed every 12 months, just depending on your symptoms and how you're going. And the other thing too, just in regards to swallowing, is oral hygiene. So I mentioned a little earlier about what we call aspiration pneumonia, and so that's where bacteria can get mixed with food or fluid or saliva and can end up going down the wrong way and into your lungs. So that obviously people can get quite sick from that, but it can be minimised, or the risk can be minimised by using a lot of the safe swallowing strategies, but also by having really great oral hygiene. So I think it's important just to think about making sure that you do have a really great program that you follow at home, and asking for support or help if you do need help with some of this stuff as well. So using toothbrushes with built-up handles, so maybe consider electric toothbrushes and flossing devices. Brush your teeth twice daily. Sit to brush and floss if standing is tiring. Floss at bedtime. Allowing somebody to help you if you need it. I think I do hear that a lot from some of my clients, that, oh, I don't brush my teeth as often as I should because I can't do it myself. So yeah, really trying to see if we can get somebody involved in helping with that. Some people manage tremors by wearing weighted gloves. That's something to talk to your OT about. Using products such as biotin to help manage that xerostomia, which is a dry mouth. So yeah, biotin's great. There's a lot of different things available there that can be really helpful for oral hygiene. Avoiding caffeine, alcohol, tobacco, using humidifiers at night, using fluoride toothpaste, using a tongue scraper or a brush to clean the tongue daily, eating a well-balanced diet without excessive sweets, and replacing your toothbrush every 3 to 4 months is really important as well. So one of the last sort of things that I wanted to talk about was just the interdisciplinary team. So this is quite an old picture of, I think it's probably a couple of years old, but my team's probably about 4 times as big now, which is quite exciting. But we've got physiotherapists, and they have a really important role in looking at your posture and trunk control, and can really help out with some of those positioning challenges for meals as well. Occupational therapists are so important for helping with looking at adaptive equipment and feeding during the mealtime. The dietitian's really important for nutrition. The medical team, so talking and having, I guess, lots of discussions with the GP and the neurologist and nurses around your management is really important as well. Support workers, carers and family members are so important. So really making sure that, because they have such a great role, and hopefully there's some of those people listening today, but yeah, you have such a great role in supporting people, and we really love working with people and building their capacity so that a lot of the things that are happening when people see us one-to-one are happening when we're not there as well. So in between those sessions, and they can really be such a crucial member of the team in identifying if there's things that aren't working and bringing that awareness to us as well. So there's just some references there, some information, some reading that I've gotten a lot of that information from. So does anybody have any questions? Is there anything that I haven't covered, or anyone want anything? I'll do my best to help.
Absolutely. Kate, there's some great questions coming in. So just let me click a couple of buttons here. By all means, please, people, put in some more questions in the control panel, opening up your control panel, typing in your questions. And I'll just give a couple of prompts, because a couple of the things that you've talked about are really pertinent as I give a bit of space to people typing in their questions. Calling MS Connect might be something that people want to do to then connect with a speech pathologist. And it's also worth us mentioning peer support. We have a fabulous peer support program. So when you have queries, like some of the things that are coming through, which we'll talk about, it can be really great to bounce that off other people also living with MS, who will then say, well, I saw a speechy or an OT or a physio, and they really helped me with this aspect. So that peer support can be a great problem-solving space to then finding the right support for issues. So I'd encourage you to think about peer support. They're just a couple of other services. Being involved, if you're working, being involved with the Employment Support Service, or if you're under 65, the NDIS program, can be such great ways of, again, connecting with support and services. My Aged Care is also available to people over 65. We've got lots of podcasts. But I'll go to some of the questions, because it might also allow us to talk about some other aspects. Because Kate, one of the things I was interested in was how people actually go about accessing a speech pathologist. Because I know you can have, if you've got an NDIS plan, you can have goals around speech that would then enable you to access a speech pathologist. Is that correct?
Yeah, no, that's correct. Yep. So definitely, if you've got goals in your NDIS plan, which the majority of the time people would have some kind of participation goal around, that we can work that in. It's all about the wording, I think, with NDIS. But yeah, participating in meal times and participating in conversations and things like that, they're awesome outcomes to have in your NDIS plan that can you then can access a speech pathologist. If you are on the NDIS, they're having a chat to your coordinator of supports. Also, not everyone has one of those, I realise. So talking to your GP or your neurologist or your medical team as well around how to access a speech pathologist in your area. The Speech Pathology Australia website, you can look up that, and that will often give you some ideas around speech pathologists in your area. And yeah, I think that's probably the main thing. But if you're not on NDIS, yeah, most speech pathologists would accept what are they called? Chronic health plans. They used to be called enhanced primary care plans. But yeah, those are also health insurance. So or paying privately. So yeah, most private speech pathologists, you wouldn't have any difficulties finding somebody there. Fantastic. Yeah, depending on where you are.
I'm glad you mentioned the primary healthcare plan too, because that was another one I was going to mention. If people are not aware, your GP, and it is your GP, not your neurologist, can write up a chronic care plan, enhanced primary care. I'm a bit like you, Kate. I'm never quite sure of what it's currently called, but it gives you access to a certain number. And again, it varies. I think it's been 5, but I think it's been extended at different times, where you can access subsidised allied health. So that might be any of the allied health that we've talked about today. It could also be podiatry or nutrition, and you can see those people for assessments or treatment over a course of a year. So that's great. So let's have a look at these fabulous questions, which I've got to say, I hope we get to them all. And if we don't, please, I will review them all to make sure we get you an answer to your questions. So I think you've covered this one, but Anne popped a comment in about how she finds she has difficulty speaking and swallowing when she's lying down. Is this a mechanical issue?
Yeah, I mean, I think there's probably a few things involved there, and I think it probably comes back to one of the slides that I had on where everything sort of needs to be integrated. So you've got your breath control, you've got your posture, I think, yeah, and plus a degree of mechanical issues as well. But it probably is a lot to do with your breathing when you're laying down, because you're not sort of able to get that breath as well as you could if you were sitting in a really supported position. Definitely try to avoid eating and drinking and swallowing when you're lying down, because that is just, yeah, maximizing the risks of it going down the wrong way. So always try and sit up if you can. But in terms of your speech, definitely it'd probably be all of those processes involved, but particularly your breathing.
And Larry has popped in that he has that experience of coughing when things go down the wrong way. So yeah, it's a really common experience.
And I think so I was just going to mention just about coughing. I mean, one of those things is that coughing is a protective mechanism. So if you're coughing, often it's actually a good thing. It's probably most times clearing it. But if you are quite weak or you're becoming weaker and you don't have a strong cough, that's when you can't, like bits of material, and only has to be a really small molecule, can go down the wrong way and set up those chest infections. So yeah, just keep an eye on that, but it's always best just to get checked out. Yeah.
Yeah, thank you. Bree's wondering if you can have either speech or swallowing, or do they always come together?
You can definitely have either. I think, like I've probably, said a lot throughout, like everyone's different. So I think that, some people aren't always aware that they're having any difficulties as well, but they actually, I guess if they say they came to see a speech pathologist, we might pick up on something quite minor that you might not have noticed. So it's probably, in my experience, more common that people will have difficulties in both in some way, but it might be, very minor in something but quite significant in the other. But because those muscles are quite, they're much the same for both, so it is very likely that you would have both in some way.
Mm-hmm. And absolutely, that also speaks to the experience of people noticing those problems worsening, particularly when they're fatigued. And with MS, we're so aware of the impact of fatigue. And in my mind, it even went to the nerve fiber fatigue, because exactly as you say, the same nerves having to fire, it can set up that activity-related fatigue for people.
Yeah, definitely. Mm-hmm.
So there's a question here about word swapping or mixing up words. How do we work out whether that's a speech problem or maybe a problem with cognition? And I was interested that you said earlier sometimes the problem is keeping up with how fast your thinking is going to be able to speak. So a comment on that?
Yeah, I think like speech and cognition just come hand in hand, and I know that speech pathologists and occupational therapists will work and overlap in this space. I think it's often, well, from what I've read, and I know that there's some differing opinions and things, but I think people kind of are saying that it's not necessarily a true language problem. I think because of the parts of the brain that are affected. Often another part of the brain, if it's affected, you probably see the more language difficulties, such as related to, I guess, someone having a stroke or something like that. but I think they very much overlap, so it is probably hard to separate them. And I certainly look at the whole thing, communication, in one sort of assessment, I guess. Yeah.
Any suggestions, or can you tell us a little bit more about the strategies for when people are finding their volume is poor?
Yeah. So I think with volume, it's often a very big part of that is that breath control. So what we would probably do in that is do an assessment of somebody's voice, which would be looking at how, I guess, doing a certain number of tasks, like being able to, could someone project their voice? So if somebody was over at the door, could you, and you know, you saw something happening, could you yell at, watch out, or something like that, to be you know, heard? So we'd probably look at that, someone's ability to be able to increase their volume. So from very soft to very loud, can they come back down from very loud to very soft? So looking at that range, looking at that ability to project. And often it would come back to that, I guess, ability to control your breathing. So the things that we would probably introduce in terms of that would be some breathing exercises or breath control exercises where people practiced being, I think I mentioned, like being able to take a deep breath, but then letting a little bit of air out at a time, because sometimes if people just let it all out at the beginning, it fades away. So being able to, I guess, work with that ability. So coordinating your breathing, knowing to take breaths. Sometimes people just keep talking and talking and don't stop. So recognizing when you're running out of breath and when you need to stop and take a replenishing breath, because that's obviously going to then fill your lungs with air, get that strength and power up to your vocal cords, which makes them vibrate, and then you have a good, strong voice. Have I answered that question? I could probably talk about it all day.
Yeah.
But yeah, a lot of that's to do with loudness. A lot of it is to do with that, I guess, integrating all of those systems, but a lot of it is breath control. Yeah.
Yeah. Thank you. Anne's made a comment about feeling her tablets or pills stick in her throat, even though she's drinking when she's swallowing them. Any hints for making that easier?
Yeah, swallowing tablets can be a real problem for some people. So there's lots of strategies that you can try. I think one of them is making sure that your mouth is not dry before you put the tablets in. So take a sip of water or something so that you've got a nice wet mouth. Sometimes popping the tablet towards the back of your tongue so that it's already kind of there. Then if the water's not working, sometimes, or I guess the other thing is you can crush tablets, you can break them into smaller pieces, because sometimes the shape of them might be what it is that's sticking. But if you can't take it with water, try with food. So maybe a mouthful of like custard or pureed fruit or yogurt, ice cream, mashed potato, something where it's nice and cohesive and you can just stick it in the spoon, and often it'll go down a little bit more easily because it all is stuck there. Whereas when you're drinking, say, put a tablet and then you drink water, you've got two consistencies, and sometimes controlling those is not as easy. But if you've got like just one sort of bolus or mouthful of food, it might go down a bit more smoothly. That's often really beneficial for people. Or if you like smoothies and things like that, sometimes maybe that can help as well. Yeah.
It takes me back to my childhood. My mum used to crush the tablets in a bit of jam.
Yeah. And some people do that. That works for some people, definitely. But yeah, often putting them in a mouthful of food is quite helpful.
Yeah. A dry cough, when actually Annette has had it's been ruled out that it's not an infection, but a problem with a dry cough, because that affects swallowing. Any suggestions or thoughts about that?
Yeah, I mean, that's probably a good one, just to maybe, it would be a good reason to see a speech pathologist, just to sort of, I guess, investigate that a little bit more, because there can be quite a few reasons for a dry cough. But I think vocal hygiene is really important, so making sure you're drinking a lot of water. We always 2 litres of water a day, and sometimes is really hard for people to do. So maybe making sure that you're drinking a lot of water, keeping hydrated, minimizing caffeine and things like that, because that actually, like, being hydrated for your throat and your voice is kind of the best therapy that you can have. It's even better than exercises and strategies and things like that. So have a little think about that. But in terms of like what is causing the cough. Like it could be various things. So I suppose probably just being able to investigate that a little bit more would be useful. But yeah, you know, trying to, I guess, rather than coughing, if you feel it irritated, a sip of water and things like that is often helpful. But and maybe that might help with that swallowing plus the voice, because yeah, the more you cough, the more you're kind of slamming those vocal cords together and the more they feel irritated. It's like a constant cycle. Yeah.
Melanie's wondering if anyone else has the experience of needing to lie down after eating, like a fatigue related thing, I'm guessing, Melanie. And I would add that could be depending on the size of a meal. You know, we're aware of that Christmas Day phenomenon, when you have the big Christmas meal and then the rest of the day your body is focusing on digesting, and so you're fatigued because of that. But
yeah,
maybe that strategy you talked about before, Kate, of smaller meals throughout the day might be more functional than having to have that big lie down.
Yeah, that's a good idea. And yeah, I think because I had mentioned, yeah, definitely trying to stay upright for 20 to 30 minutes after a meal is always good, because it just makes sure that everything goes down. You've got nothing sitting there. There's nothing still sitting in your mouth. You're just given a lot of time for that process to kind of clear itself. But if you're feeling really fatigued, and like maybe just think about how you're sitting. Like if you do need to kind of get in a more comfortable position, just don't lay flat. So maybe just try, if you need to get into bed and have a bit of a rest, have the back of the bed up or pillows propped up or whatever sort of bed you have. But just try to avoid that whole laying flat directly after a meal. And that'll help too, because if some people, like a lot of people with MS do experience reflux symptoms, so just making sure you're not laying flat is going to help with that feeling as well.
That's an amazing segue to another question that Janet's popped in about esophageal reflux. Is that connected to MS swallowing difficulties?
Yeah, I certainly have seen a lot of that with all of my clients that I've seen. I think the important thing to maybe discuss reflux with your GP, because often, yeah, they can recommend medications that you could trial and see if it helps. Definitely, like as speech pathologists, we very much sort of work in this area, and once it gets to the esophagus, it moves on to the gastroenterologist realm. But we also do work with it, I think, you know, because it has that overlapping effect that, you know, you can have problems swallowing and then you get the reflux and then it's coming back up. A lot of people, if they're going, oh, things are stuck here, or I can feel stuck here, it's usually something maybe to discuss with the GP. If any further investigations, maybe they'd go to the gastroenterologist, but often it can be just something simple by trialing a medication, or if not, there are definitely strategies that we could use. Some of those things that I would recommend are thinking about positioning in your for your meal times, not lying flat when you go to bed, not having a heavy meal right before you go to bed at night, maybe having a lighter meal at night. Sometimes having a mouthful of food and then having a little sip of water, so that you're kind of cycling that feeling and you're not getting the reflux symptoms as significantly. But yeah, so it definitely overlaps and it's quite common.
Cool. Teresa's noticing her voice goes croaky. So not necessarily a volume, but a croakiness. What would be a thought around that?
Yeah, definitely. So that's definitely something that you can notice changes with the voice quality as well as volume, or sometimes you just have a croaky voice. So it's more about how your vocal cords are working, and it can be definitely related to the same things as those lesions impacting on the brain and the coordination and muscle movements of the vocal cords. So yeah, we definitely have that we would work with. So there might be again an element of vocal hygiene, but also there might be some exercises or some strategies that we could introduce to assist with that.
Great.
And that can come back to breathing again, like, yeah, so it's, yeah, a lot of it's all overlapping.
Yeah. A comment about the biotin. You mentioned the biotin for dry mouth. It comes in a spray or a liquid. Is there one better than another?
Yeah, I think a lot of the ones that I've seen have been more successful are the sprays, so the artificial saliva spray one. So it's just like a little spray that you can just spray in your mouth, and it just gives you a little bit more moisture. Biotine's got some great products. They've got you know, some toothpastes and things like that as well, which can be good for dry mouth. So I've got one participant who gags when he cleans his teeth, but actually I don't know if it's Biotine, but there is like a toothbrush powder that he just adds a little bit of water to. So that's another thing to think about if you have trouble with lots of foam and you're a bit more sensitive to brushing your teeth. But yeah, Biotine you can get from your chemist. So have a little look there if you've got a local chemist, and if you can't see it, just ask them to order it in.
And it might be a matter of trying both.
Yeah, sometimes it's a bit of trial and error. Sometimes people I think, oh, everyone loves that, but then I'll find someone who doesn't love it. But yeah, so it's a little bit of trial and error, but some people like things more than others.
Yeah, thank you. Kate, thank you so much for your time. We've run a little bit over our hour, but thank you for staying on and answering all those questions. I hope people have felt that their question has been answered, and if not, MS Connect would be your first port of call, and we can then connect you to Kate for an answer or someone more locally. But it's been fabulous. All your information is great. Those handouts are terrific, full of such good information to reread and check back on again later. Thank you so much for your time today and your time preparing as well. And we'll look forward to seeing you and everybody else at future webinars as well. There's a little survey that will pop up after the webinar's finished. We'd appreciate your feedback in that too. So thanks everybody, and thanks again, Kate. We'll see you at another webinar.